Hi, Dr. Funk here. I'm so excited for you to start your smile journey with aligners, and I just have a few tips and tricks to go over with you. You can always reference back to this video if you ever forget or have a question while you're in treatment. The first and most important thing is that you want to be wearing your aligners 20 to 22 hours per day. They're designed to be worn full time. That means whenever you aren't brushing your teeth, eating or drinking anything but water, your aligner should be in your mouth, especially while you're sleeping. This will ensure that you get the best and fastest results. Like I said, you do want to remove your aligners when you eat or drink. It's okay to keep them in if you're just having water, but anything else you want to make sure that you take your aligners out. Things like coffee and tea will stain your aligners and make them much more visible to others. Also, hot liquids can distort your aligners because they are made of plastic. It's super important that you don't eat or drink with anything in your mouth because that is basically locking that food and bacteria onto your teeth, and that's not good. We don't want you to end up with cavities for the sake of straight teeth. Taking your aligners in and out. Trust me, the first few times that you do this, it might be a little bit tricky. You might find that you need to go in front of the mirror and you might struggle a little bit at first. Don't worry, it will get easier. Once you get a feel for how to take the aligners in and out around your specific teeth, you'll be able to do it faster than we can in the office when you come in for your next appointment. Also, as your teeth get straighter, it gets easier to put them into place. You always do want to make sure, though, that you're using your fingers to put them in and out. Never just bite them into place, as this can bend your aligners and then it won't move your teeth the way that we want them to. Just press down and make sure the tray is securely seated around all of your attachments. Ideally, you would brush your teeth every time you put your aligners in and out. But if you're out somewhere and you aren't able to, at least make sure that you rinse with water to remove any large food debris on your teeth before you put them in. And then, of course, as soon as you get home and you're able to, take your aligners out, brush your teeth, and clean your aligners. Tracking. Tracking is super important to the success of your treatment. We want you to keep an eye on your tracking. It's normal when you put a new tray in that you might notice a small gap between your tooth and the top of the aligner. As the teeth move, though, the tray should fit better and this gap should disappear. You always want to make sure there are no gaps before you switch to the next tray. Here's a picture of what tracking looks like. You always want to be in that top left picture in excellent tracking, where there's no space between the edge of the teeth and the aligner. When you start to see small gaps like you see on the top right, that's when you want to use your chewies to really press down the aligner around the teeth and make sure that it's fitting well. You never want to get into problem or poor tracking where you see significant space between the aligner and the teeth. That means that the teeth aren't moving along with your tray. If you need to, make sure that you stay in your aligner a little bit longer. Just because we tell you to change your trays weekly or every 10 days, if there's still a gap there, we want you to stay in that tray longer and really use your chewies so that you can get the teeth caught up to the movement. If you keep going forward in your trays, that gap is just going to grow bigger and bigger and the tooth will get left behind. If you need to stay in a tray up to 2 weeks and you still feel like it's not moving the way that it should, please give us a call and we'd be happy to take a look at it. Numbering. As you probably know, all of your aligners come in personalized bags with the aligner number and your name printed on the bag. There is also a number on each aligner so that if they're no longer in the bag, you can tell which one is which. There's a U and an L for upper or lower, followed by the aligner number. This is so that you can tell which number it is. Here you see this is lower 01. Cleaning your aligners. Like I said, ideally your teeth are always clean when you put your aligners in, so the aligners really shouldn't get too dirty. However, if you need to clean them, I recommend using a toothbrush and clear dish soap. I have a separate toothbrush that I use to clean my retainer, and I use dish soap on that toothbrush. As long as you make sure that it's rinsed off well, it shouldn't taste soapy when you put it in your mouth. Some patients like to use toothpaste or denture cleaner. However, I don't recommend those because with time they can cause your aligners to get kind of cloudy because of the grittiness in them. If you do want to use a tablet, I would recommend either the Invisalign cleaning crystals or a retainer or aligner cleaning tablet specifically. What do you do if you lose an aligner? We always recommend that you keep all of your aligners until your treatment is completely finished. So that means when you finish with tray 1, you put that in the aligner number 1's bag and then open up number 2. That way, if you lose or break an aligner, you can always go back to wearing your most recent aligner until we're able to order you a replacement. If you are close to switching to the next one, about day 5 of 7 days, it's okay to just move ahead to the next aligner and just make sure that you stay in that one a little bit longer and that there are no gaps when you're ready to switch to the following aligner. And that should pretty much cover it. If you ever have any questions, feel free to reach out to us at the office, either via email, text, or phone call. Again, we're so excited for you and we can't wait to see your fabulous results.